The exciting success of ICVX, a new chapter in the fight against HIV in the U.S. In the decades-long fight against HIV, there have been many hopeful moments and a few heartbreaking setbacks. But the recent success of ICVAX, a promising injectable HIV therapeutic vaccine currently being tested in the United States, is giving doctors, patients, and advocates alike fresh reason to believe we're entering a whole new era of treatment and prevention. Let's take a closer look at what ICVAX is, why it's so exciting, and what the clinical trials have shown so far. What is ICVAX? ICVAX is an innovative therapeutic HIV vaccine designed to help the immune system control HIV infection more effectively. Unlike preventive vaccines, which aim to stop HIV infection before it happens, therapeutic vaccines like ICVAX are given to people who are already HIV positive. The goal? To strengthen the body's own immune response so it can suppress the virus with minimal help from daily antiretroviral (ARV) medication, or even without it altogether. This could improve quality of life, reduce drug resistance, and lower long-term medication costs, a truly transformative breakthrough for millions living with HIV. ICVAX uses advanced genetic engineering to teach the immune system to recognize and attack HIV more effectively. It works by delivering a specially designed antigen, a substance that triggers an immune response, to the body via an injectable formula. Early research suggested that this unique approach could re-educate immune cells that have become exhausted from years of battling the virus. Why injectable therapies are game-changing. One of the biggest challenges facing people living with HIV is the lifelong need for daily medication. Although ARV therapy has turned HIV from a death sentence into a manageable chronic condition, the pills come with side effects, the risk of resistance, and a psychological burden. That's why there's been such enthusiasm about long-acting injectable treatments. Instead of taking a pill every day, patients could receive a shot just once every month, or even every few months, to keep the virus under control. ICVAX takes this a step further. If the vaccine proves to be as effective as it appears, patients might eventually be able to go even longer between treatments, and some might even maintain control over the virus with little or no ongoing medication. The U.S. clinical trials promising results. So what have the U.S. trials shown so far? The most recent phase 2/3 clinical trials enrolled several hundred HIV-positive volunteers in multiple sites across the country. Participants were diverse in age, race, gender, and length of HIV infection, making the results more robust and applicable to the wider population. Here are some of the key findings. Improved viral suppression. Among participants who received ICVAX, about 75 to 80% maintained undetectable viral loads for at least 6 months after stopping traditional ARV.